Hello, my name is Marianne Williams. I'm a specialist gastroenterology community dietitian working for Somerset Partnership NHS Foundation Trust down in the southwest of the UK. Over the last 2 years, we've been running webinars for patients on subjects such as IBS, inflammatory bowel disease, celiac disease, and various other topics. And we've been asked by several people if we can give them advice on how to run their own webinar. I know when we started, there was almost no advice out there for people wanting to do this. So we've put together a presentation and hope that this will help you. Our team is made up of Kerry Marchant, who is our webinar guru, myself, Leah Seamark, who is our stats and outcomes guru, and Leslie Harper, who has done an amazing job creating our website, so she's our IT guru. Today it's just going to be me speaking because this is just an education video itself. So without further ado, what outline of what we're going to cover. So initial considerations. I want to sort of go through what you initially need to think about, pros and cons of running a webinar live or on demand, creating a presentation, questions and answers for patients, editing a webinar, outcome surveys, and marketing your webinar. Now, we're not going to go into each of these areas in minute detail. We're just going to give you rough outlines so that it gives you the chance to get going and create your own webinar. I want to just cover the fact that we now have, with NHS Digital and other AHPs, created a framework for adoption for anybody wanting to run webinars for national use. And I think this is a really useful document for people to look at. We've put it on our website, patientwebinars.co.uk, under Health Professionals page. You can see their national webinar guidance, and you can download that document straight from there. So very easy to access. What we do suggest is that if possible, you do your webinars in a generic fashion, in the sense that you will put, you can see here in the centre, we've got Somerset Partnership NHS Foundation Trust, that's who's creating this particular webinar. This is an example of one we've created on the FODMAP diet, but up here in the top right, we've got a generic NHS logo, and that follows through all the slides after that. So it's very much a webinar we've created, you can see this, but after that it's debranded so that any CCG or department can use it nationally free of charge. So how do you start? First area, which might seem an illogical area to start, is to get your IT department to allocate you a dedicated webinar email address. So our IT department set up patient.webinars@nhs.net for us. The nhs.net gives you all sorts of opportunities, and I would suggest you do the same. You don't want to bog down your normal dietetic email system with webinar emails. It keeps it very separate and much more easy to administrate and manage. Who is the webinar aimed at? That's obviously fundamental. You want to really look at who you're aiming this webinar at and make sure that you're aiming at the right people. And agree a title for your webinar. Keep it simple, a title that says what it is on the tin so that everybody can see immediately what this webinar is going to be about. And I would really suggest that you ask patients with that particular condition to give you feedback. So we did survey monkeys out to patients, for instance, with irritable bowel syndrome, and said, what is it that you want to know about? Because we wanted to make sure that our webinar was answering their queries and giving them the information they really wanted rather than the information we thought they wanted. Then it's really a case of deciding, are you going to have a webinar service, or are you going to just have a simple recording service? And I'll go into more detail about why. So if you're going to run the webinar live, or whether you're going to run the webinar on demand. So for the first 8 months, we ran our webinars live. We had them on a set day, the third Monday of every month at 7 o'clock in the evening, and people would register for that and attend on the evening. And that's how we ran it. Now we run them on demand. So we record them and then we make them available so that people can watch them any time. So if you're running them live, we use GoToWebinar. There are lots of webinar services out there. We're not promoting them specifically. It's just the only one we've got experience of using. So if you're running them live, a webinar service is very, very useful. It allows you to run polls, for instance, during the live webinar, so that you can send out questions to the audience who are watching and they can actually answer questions there and then, and you can get a feeling of whether people are understanding what you're saying. Very useful. You've also got the opportunity to do questions and answers, so patients can type in questions and you can answer them there live, and that's also extremely useful, particularly if you've got panelists and they want to ask specialist questions. And then most webinar services allow you to add in at least 5 downloadable information sheets, so patients can download those resources while they're watching the webinar, which is also incredibly useful. We used to add a self-referral form as one of those downloadable sheets as well. And interestingly enough, we only got 16 self-referral forms back in 18 months. So the idea that you're going to flood your service if you make self-referral forms available doesn't seem to pan out. So really recommend you can have the fact that you can have downloadable information sheets on the webinar service as well. Patients access the webinar via the webinar service. They have to put their email address in, and this was covered by our information governance team with GoToWebinar and was allowed to go ahead. But what you have to bear in mind is that every patient will email you wanting a link to the webinar so that they can register for it, and so somebody has to administrate that, hence the picture of the little person over the computer. Somebody's got to administrate sending that email out. Now, it might be the same email going out each time to each patient. It's a generic email, and we put a link to the survey, and then the outcome survey, and then a link to the webinar on it, and then a link to the post-webinar survey on that email that goes out to each patient using our specialist email account, the patient.webinars@nhs.net that we created for us. But somebody has to administrate that, and that takes time. It might be quite quick for each individual patient. When you're starting to get a lot of patients emailing you, that can be quite difficult to administrate. We also did find that it was difficult for patients to start and stop the webinar if they, for instance, their child started crying, they had to go upstairs and quickly deal with the child, or they had an emergency, or they wanted to stop and have dinner, or they just wanted to have a rest, have a coffee. They then couldn't watch the rest of the webinar. They had to wait for an email to be sent the next day so that they could carry on watching it. And we found that quite cumbersome. Or what we've done now is we actually record the webinars on demand. Now, we're still using GoToWebinar to do that, but we're starting to move over to using Zoom because it's free. And I'm using Zoom now to record this webinar. And it's a free service. I think you get up to 45 minutes free to record. And then if all you're doing is just recording, it's a very simple system to use. You can then download the finished webinar onto your desktop. And you can do that either from GoToWebinar. They have a folder in there which keeps all your recordings. You can just download an individual folder, individual file onto your desktop so that you can edit it. And with Zoom, they automatically download your copy of your recording into a folder on your desktop. So once you've got it there, you can then edit that. Now, what we do with our recordings, so for this recording with Zoom, we will edit the webinar and then we will put it up onto our YouTube channel. Now, that might sound quite scary to those of you that don't know how to set up a YouTube channel, but I promise you it is so simple. You literally sign up and there you go. You choose a name for your YouTube channel and that's it. Now, this is an example of a page on our YouTube channel. So you can see here our YouTube channel logo. This is it here. And we've called our YouTube channel Patient Webinars. So you could call yours whatever you want. And it's got examples of some of our webinars on there. This little emblem here, a little camera with a plus sign, is where you click on that and that allows you to upload your latest film onto the YouTube channel. So really, really simple to do. Some YouTube channels say you can only do a few minutes, but you can actually override that. I'm afraid I can't remember how, but there's a way to override it so that you can put long videos up onto YouTube. So very simple to do that with that little camera emblem. You get separate pages. So for instance, here on our YouTube channel, we've created a little picture for the front. So that's what people see, the green emblem for our low FODMAP webinar. We've got different colors for different webinars. This here is our YouTube link code for that webinar. So that is the link code that you're going to use. And here's a description of the webinar and some tags. Now, this is so that if somebody searches for a webinar on the internet, all these tags will help them to find your webinar. So what you do with that link that I showed you, that generic link, is you then paste it into your website, and you can even link in copies of your handouts. So this bypasses the need to use a webinar service because you can link your handouts directly into your own website. Now that could be your trust website, or like us, it could be a website that you've created specially for your department. But this picture of the video here that you can see is purely there because we've attached the YouTube link that I mentioned earlier into the website. Okay, so what about tips for engaging webinars, creating engaging webinars? Well, I would suggest you want a minimum of 2 people to set up and run a webinar. I'm doing this on my own today because it's just an education session, but actually if you're running a webinar for patients, I would really recommend you have 2 people. I can't overstate even enough that your staff will need protected time to do this. It seems very simple and very easy to anybody who's not done it before, but it does take time. What I would say is it is worth that time. So here are our dietetic referrals into our gastroenterology clinic. And in the first year of running the webinar, so that central third section you can see there, the first section before we ran the webinars, second section the first year after running the webinars, and now the third section of what's happening to our referral rate now that we're taking on new conditions. Basically, our referral rate dropped by 45% in the first year once we started using the webinar. So they were incredibly useful. We've now been able to revamp the pathways for celiac disease and inflammatory bowel disease, and have now started to be able to take on those patients as well, which would have been inconceivable before the webinars. So although they take time to set up and get done, once they're done, they quietly tick over on their own, collecting data. You don't have to do anything apart from review them once a year, and they bring down your referral rate. So really worth that investment in time initially. Who will you need as panelists or experts? Sometimes we run webinars just with our dietetic specialists in our department. Sometimes we bring in panelists or experts. So celiac newly diagnosed webinar, we had 2 gastroenterologists from 2 different hospitals, and we had a specialist, a celiac dietitian. Our inflammatory bowel disease webinar, we had a specialist GP inflammatory bowel disease, a specialist nurse, and we had a specialist dietitian and a specialist gastroenterologist. So all of those were panelists on that particular webinar. But you could just do it with your team. It depends what you're doing, what you're trying to achieve. What do your patients want to know about? This goes back to the slide I showed earlier about perhaps survey monkeying your patients and asking them what it is they want to know about most. So make sure you've got information on your presentation that they want to know about. And creating your presentation, this is really important, because I would really discourage you from using the webcam. You can see today that you haven't seen me at all. I find it very distracting because people are busy looking at you, looking at what you're wearing, looking at what's behind you in the room, and not actually watching concentrating on the presentation. So I would really recommend you don't have the webcam on, but therefore your presentation needs to be super simple and easy to look at. Keep the presentation to 30 minutes max. Keep the slides very simple, lots of images that you can then talk around. Avoid lots of text or bullet points. You will need bullet points. There's no way getting around that. And things like Smart Art, which is a facility on PowerPoint, can make the bullet points highly coloured and much more interesting to look at. So make it colourful, make it appealing to the eye, limit the text. Microphone, really important. Haven't got my microphone here today, so I'm just doing it on the computer, and the audio will be okay, but it's so much better with the microphone. Now, when you're doing this for patients, it's absolutely imperative that the audio quality is good, or patients will just stop listening. So we use, this is an example, we use the Yeti, and this is a very good Yeti. It's about £120. Sounds like a lot of money, but it's the only investment your department need to make, because all you need otherwise is a laptop with a webcam and people. So this is the only investment, and you can share it amongst your department for doing different webinars. So although it sounds like a lot of money to begin with, it's very sturdy, really well made. The important thing about the £120 one, as opposed to the sort of £70, £80 one, is this one, it can become omnidirectional. So when we had a single one, you could only hear people really well on one side of the microphone. This one allows it to take in audio equally from all sides of the microphone. So it is a bit more expensive, but definitely worth the money. If possible, have 2 people presenting to vary the voice. You're going to get really bored of my voice over this webinar. And if you have 2 people, it just makes it much more appealing to listen to, so that people don't get bored of hearing one voice. Pre-arrange the division of slides, and try and avoid sounding robotic by using a script. Very tempting to try and get a script together, but it can sound terribly robotic, and I would really discourage you where possible. You might want to have a very good storyboard of where you're going. So who's going to talk over which slides, who's going to ask questions, etc. But keep it free moving. It allows you to actually spontaneously interject during a comment that somebody's making and ask them a question there and then, which might be a very interesting question for the patients to listen to. So make it much more relaxed, a relaxed environment, a more chatty environment. If you use the script, it tends to be very robotic and not so appealing to listen to. Decide on what downloadable information sheet you're going to want to have, and make a list of frequently asked questions. Now, you're going to have a pretty good idea of what the frequently asked questions are based on the feedback you got when you first SurveyMonkeyed your patients. So use that. We also did our webinars live, as I said, for the first 8 months, and we would have a question and answer session. People would type in questions, and we collected all those questions together after the 8 months and realized that almost every time we ran it, there were identical questions coming in. So what we did with the final one is that we made sure that we answered all those questions during the webinar. And I think that really helped make sure that people were getting all the information they needed. You can dedicate one person to asking the questions. If you want to present the questions in a question and answer type of fashion, then you can ask the questions to the panelists or experts and they can answer them. Make sure you've pre-allocated which of your team will answer which question, and don't surprise them with a question they didn't know was coming up. So make sure everybody's aware of what questions are going to come up, who's going to answer them, and then it will run much more smoothly and people will be ready with a good answer. Set a date for a practice session. Really, really important. Now, if you're running it with panelists and experts, you're not going to be able to get them all together properly for a practice session. Our guys for our inflammatory bowel disease webinar, for instance, came from all over the Southwest, so impossible to get them together for a practice session. But what we did do is run a practice session through Zoom, which is what I'm using today, and that worked really well. So they were all sitting in their own homes in the evening, and we ran through the whole webinar remotely. I would suggest, however, that when you're running it a live recording or running it a recording that you want to keep for on demand, that you set a date and you run it with you all in the same room. That will make sure that the audio is much more appealing. You're less likely to get technical difficulties in getting somebody cut off at the other end or losing signal. So I would recommend that, if possible, when you do the final recording, whether it's live or on demand, you're all in the same room together. You will make mistakes. Everybody does. Even if you're just running a short 10-minute webinar, the chances are that you're going to stumble over words, or you're going to say something wrong, or you think, oh, I need to edit that out. Don't worry about making mistakes. Whatever you do, don't restart the webinar. You can always edit it afterwards. So take a deep breath, wait for 5 seconds, and then carry on talking as if nothing happened. And you can edit out that chunk afterwards. Editing the webinar is really useful. The one thing to remember about editing the webinar, however, is that if you're doing a webinar through GoToWebinar or a webinar service, when you edit it, you will lose the polls. The polls will no longer work. People will be able to see the polls and what the answers were, but they won't be able to take part in them. And that might not matter for you if you're now going to run that webinar on demand. So what some people do is they run the webinar live and then they edit it and put it up on demand for people to watch afterwards who weren't able to attend, and the polls won't work. But actually that may not matter for you, but it's just something to bear in mind. For editing, we use iMovie, or I use iMovie, which is free on iPads and Macs. If you don't have an iPad or a Mac, you might want to use PC editing, and HitFilm Express is one that's been recommended to me. I've not used it. I don't know how well it works, but certainly one of our team has used it and she's edited a webinar brilliantly, so it must work well. Apparently they've got a free version of it, so I would suggest having a look at that for editing. And then you save your edited webinar. As I said, you save your edited webinar and you can either upload it back onto GoToWebinar for patients to access through the GoToWebinar service or whatever webinar service you're using, or as I showed before, you can edit it and put it up on your YouTube channel. So what about outcome data? Outcomes really, really vital. You're going to need to prove that this form of education has worked and is successful. And you're going to find that you will get people who are doom mongers who say, oh, it won't work, it'll alienate the older population, people won't know how to work, it'll be too complicated. So I'm going to show you some of our data which will disprove that, but you need to collect outcome data. It's really important. You need to collect outcome data pre and post webinar so that you can prove that you've educated them or that it's been beneficial. Some of the webinar services have automatic surveys. I'd give them a big thumbs down. I find them too difficult to get accurate data from. They're not complex enough and they don't really give you usable data. You want to use things like Likert scales where you've got much better data coming through. We use data collection tools like SurveyMonkey or Questback. We used SurveyMonkey initially. SurveyMonkey is free for the first 100 responses you get, and you get 10 questions that you can ask free. Over 100 responses, you've got to start paying for the service. Questback, our trust brought in Questback for their own use, so we were able to access this, and it means we've got the full service and it's extremely useful. They're both very similar. It just happens that we now use Questback because our trust has it. So what type of survey questions do you need to ask? Now, these are just examples of what we're asking on our IBS surveys. You may have different questions for different reasons that you need to ask, but we often get people wanting to know what we do for ourselves, so I just want to give you an idea. So we ask for age of attendees, how likely are you to recommend the webinar to a friend? How easy was it for you to access the webinar? We do a pre and post question on IBS dietary knowledge so that we can see if their knowledge has improved after the webinar. We ask which of the following factors were important to you when choosing to attend the webinar. What would you have done if you had not accessed this webinar? Who gave you the details of the webinar? And we also do pre and post, would allergy testing be useful in finding a solution for your IBS? Now that's a sort of almost like a secret education question. I'll explain more in a second. So this was our data on how likely are you to recommend the webinar to a friend suffering with IBS. And you can see the vast majority said very likely, nearly 60%, and another 32% said likely. So you're looking at a large proportion, 91% of people saying very likely or likely they would recommend it. Which of the following factors were important to you when choosing to attend the webinar? Now, number one by a long way was getting access to accurate and reliable information. When all there is out there for patients is Dr. Google, you suddenly realize that actually these patients really, really value listening to specialists from the NHS who are giving them the most up-to-date and reliable information, and they hugely appreciate that. And that's why by far and away it was the most important reason for them attending. The second most important reason, which really surprised me, was being able to re-watch the webinar whenever you want to. So this is encouraging patient self-management with consolidating their knowledge. So they can re-watch sections of the webinar. Perhaps you didn't understand a bit, they re-watch it, or perhaps they re-watch the whole webinar and they can re-watch it as many times as they want to consolidate knowledge. How many times have we left a consultation with somebody and scratched our heads after and said, oh, what did he say? I've completely forgotten. So this way they can keep re-watching it until they feel satisfied they understand it. And this may indeed be why the fact that we put in self-referral forms as a downloadable sheet, and we've actually only had 16 back in 18 months, because people, once they've got the right information, don't actually feel the need to come and see you. Then you've got no travel required. This is a big one. We set up group sessions for our FODMAP diet, and nobody would turn up. We'd get 8 signed on and 1 might turn up, or none might turn up. It was a complete disaster because IBS, for instance, is a very female-dominated condition, and they didn't want to sit and talk about their bowels in front of other people. So no matter how much we persuaded them they weren't going to have to do that, they just would not attend. So being anonymous for these webinars is important, but also a lot of them didn't want to travel. They didn't want to travel to come to a group session where they felt they might be humiliated. So no travel, no parking costs. That might seem trivial, but when you're paying £10 to park your car just to come for a group session, that becomes significant. And no need to take time off work. Really, really important. They can watch this at night. They can put their children to bed. If they're caring for somebody, they can watch it when it's suitable. They can watch it when they're commuting to work. They can basically choose when they want to watch it. So no need to take time off work. And the fact that it's an NHS created webinar is so important to people because they trust the NHS to give them the right information. IBS dietary knowledge pre and post webinar, 57% said they had fair, good or excellent knowledge before, but that went up to 94% after the webinar. So really important that people felt they'd really improved their knowledge post-webinar. This was our secret little question: would allergy testing be useful in IBS? Most of our patients with IBS feel that allergy testing would be useful. You can see pre-webinar, 62% said yes. Post-webinar, 63% said no, which was the right answer. So during the webinar, we explained to them that allergy testing won't be any use. So this showed that not only did they feel they had more knowledge, but they'd actually taken on board the information, assimilated it, understood it, and were now able to answer a question correctly at the end. So we were really proving knowledge. It wasn't as simple as them saying, oh yeah, I feel as I've got more knowledge. We could actually prove they've got more knowledge. The age of the attendees. So as I alluded to before, lots of people said to us, oh, you're going to alienate the older population, particularly in Somerset, where it's a very rural population, lots of farming, not necessarily very IT savvy. And actually here you can see our 65 to 74-year-olds were one of our largest groups, our second highest group, both before and after the webinar. So really, really important that age is not a discriminating factor with using webinars or technology to give patient education. This was some data we collected through NHS UK when they put our IBS webinar live up onto the NHS Choice or NHS UK website. They asked if this video had not been available, what would you have done instead? 20% said they'd have asked their GP for appointment, and another 13% said they'd have asked their GP for a consultant referral. So it's really important that these webinars are reducing the burden on primary care and secondary care. So you can see here that 33% would have gone to see their GP if you combine those two together, and there would have been a burden on secondary care. And by offering the video or the webinar, we were reducing that. So if you're emailing or texting the webinar link when you send the survey link, so if you're doing live webinars or you're using a webinar survey system, then you're going to need to email or text the link to that survey. Keep it simple, and you can text the survey link at the same time so that the patient is encouraged to fill in the survey before they attend the webinar. Or you can attach the survey to your website. So in our website here, you can see the big red block, IBS First Line Advice webinar, and it says, thank you for completing our pre-webinar survey. So we direct them straight to the survey before they get to this page. Then step 1 is they can watch the webinar, and step 2 is please click here to complete the post-webinar survey. So that's what we've done through our website. Here on YouTube, underneath one of our YouTube images, we'd also tried putting a link, a direct link. So here, click on here for the survey, and click here for to reach the leaflets which we've got on our website. So you can put the link straight under your YouTube where you've got all the descriptions here. You can see patient webinars and descriptions about the webinar they're going to watch with the live links. I wouldn't say you get such good feedback using these, but it is another alternative way to access, for patients to access the surveys. So send your webinar out for review, get feedback. Is it good or bad? Did it make sense? Send it out to GPs, to healthcare professionals, but also send it to a sample of patients that you feel will give you honest feedback on it. And I think then you feel ready to send your webinar out for general use. Reiterate again, staff will need protected time to do a webinar. I'd say 2 full days minimum in total, absolute minimum, probably more like 3 days in total, and that might be spread over several days. It took us a long time because we were starting from scratch with no guidance whatsoever, but you will need to work out how to use all these different tools like your webinar service, like Zoom, like YouTube, etc. And it takes time, so staff do need protected time. I would suggest you might want to make 1 or 2 staff members in charge of IT development in your department. It will make it much simpler. And then marketing. Marketing your webinar is everything. You could have the best webinar in the world, but if you don't market it, then no one will know about it. Use social media, which might be scary for those of you who've not used it before, but things like Twitter, I only started using Twitter a couple of years ago, and it is unbelievably useful for spreading knowledge around and spreading links to your webinars and letting people know about them. We've also got a patient webinars Instagram account. We haven't gone into Facebook yet, but really use social media. and then give talks to GP groups. Your area will probably have GP get-togethers several times a year where you can go and give a talk about the webinars. We give talk at national conferences, we'll give talks on international webinars about what we're doing. So any way you can get the message out there. And then, of course, mailing out. When we get a referral for an IBS patient, we send them out a pack, and in that pack will be information about the webinars. Our secondary care consultants have got the webinar website address on the bottom of every single letter that goes out from their department. And then make sure that you get an email list of all relevant healthcare professionals. So we have an email list of all practice managers in Somerset, senior GPs, healthcare professionals and pharmacists, and we mail out to them once a month. Now, I was worried that we might be overburdening GPs by mailing out once a month, but actually the feedback that came back was, no, we're really busy, we forget, so please keep mailing us once a month to remind us. And we email the latest webinars that come out, or anything that's happened with the webinars, the latest statistics that come out of the webinars, just to encourage people to use them. And marketing never stops. Send out that monthly reminder. Don't think that just because you sent out one email to all the GPs locally that that's it, you've done. You've not. You've got to keep going. It doesn't happen overnight. Be patient. When we started, we were getting perhaps 4 emails from patients a week saying, please can we have the link to the webinar service. This is before we had our own website where they can just go on now. But when we were doing it through a webinar service, we were getting about 4 a week, then we started getting 10 a week, then we started getting 20 a week. But it took months to build up. So be patient. It will happen as long as you're marketing it. The more people that know, then the more the word will spread. And set a review date for your webinar. 6, 12 months. Collect all the information you've got back, or the feedback you've got from your surveys. So on our surveys, it gives them free text feedback as well. And then when you review your webinar, perhaps change it to give back the information that people are most requesting. And just try it. Just do it. Just go ahead, do the webinar. You'll never be able to iron out all the creases before you start. It's only once you've done a webinar that you can sit back and go, okay, I've learned from that. Now I know how to do it better each time. When we first started, they were all a disaster. We were making mistakes all over the place, and you just slowly streamline it and get into it. But the savings that can come to your service are so huge potentially that it is really worth making this adjustment and creating a sort of, you will have people in your team that you can create a little IT team within your department. You'll be surprised. People won't even have told you that they love IT or love tinkering with making websites or are good on social media, etc. And give those tasks to different members of your team and get a team who are interested in doing this. This is really going to be a major way forward in the future and a way of us reaching so many more patients. The fact that a patient with celiac disease now, who would have previously had to wait several months to be seen, can now access a webinar immediately on newly diagnosed celiac disease and then download a self-referral form and still be in the system. So they'll still go and see a dietitian when they're newly diagnosed, but it takes a huge pressure off the service, the dietetic service, that they don't need to see them immediately, that they're getting good, reliable information directly from a team of NHS specialists and then coming into the system when the system has time. So I really can't stress enough how brilliant these webinars are. You may struggle, you may be tearing your hair out at stages, but just do it. It will be worth it. And I hope you found this webinar helpful. And thank you very much for watching. Goodbye.